So, Professor Hassanein, as a very experienced endocrinologist and a diabetologist, there's a common belief that eating too much sugar can cause diabetes. Is this true or is this just a myth?
Well, it's like everything, it's half true, half a myth. So we all eat food that is rich in sugar or rich in carbohydrates, such as bread, too much rice, too much potatoes, too much pasta, and so forth. Why does one person develop diabetes and the other person does not? So if my pancreas is a bit weak and I exhaust it, and the pancreas is the part of the body that is able to process the sugar, the carbs in general. So if my pancreas is a bit weak and I overload it with too much of that type of food, whether too much sweets, sugar, or carbohydrate, then I will be getting diabetes. And that's why we see one person eating whatever they fancy and never get it because their pancreas is not weak, and another person would get it quickly. But the important point in your question is that if my pancreas is weak, and I might know that because I come from a family full of diabetes. So indirectly, I should start thinking I'm prone to get diabetes. So be careful and be more active physically and cut down on carbohydrate. Not just sugar, but sugar and carbohydrate.
So, guys, you've heard it all. If it's a myth or it is true. So, the fact that you have a family history, then you need to have it checked. So, Prof, what does the role of diet play in diabetes, either as prevention or even as a form of therapeutic intervention, so to speak? Because if you look at most of the guidelines, all the guidelines, the first thing they say is lifestyle and diet, okay? So that means that there is a role for diet. So let's talk about diet first, and then we'll go to lifestyle modification. What is your point?
This is really the crunch of diabetes and obesity. So first, we need to understand what is the problem in a person with diabetes. So recognizing that my pancreas is weak, my pancreas is not producing enough effective insulin, and insulin is the tool that breaks down glucose in the body.
Right.
And we said that glucose in the body is the outcome from either sugar or carbohydrate, bread, rice, potatoes, corn, and anything that is wheat, of course. The main culprit, I've said bread. So anything made of flour, anything made of potatoes, anything made of rice or of corn, with all their derivatives. So if I understand this problem, then I need to cut down on these. These are types of food that we have to generate energy. So I'm a doctor. I move from home to work. I sit in an office. I'm not a farmer working in a field burning lots of calories. So I need less of the food that generates energy. Did I say I do not need any? No. So my advice to any person with diabetes, look into your plate and cut down the carbohydrate and sugar into half.
Right.
Half the bread, half the rice, half the potatoes. If you're thinking of a drink, there is no better drink than water, so that you don't end up with more sugar in a drink. At the end of the day, it's a drink. Even fruit juices. When you want to make, and some people are conned, they think it's fresh. Yes, but I've taken to make 1 glass of orange juice the sugar and the water of 3 big oranges to make 1 glass.
Yeah.
Now, thrown away is the fiber, which will make me full. I cannot eat oranges in one go because it will make me too full. But I can drink an orange juice. So this is the tactics, the clever tactics that the person with diabetes can do to avoid sugar levels being too high.
Right.
So changing my liquids, the fluids that I eat, cutting down on my carbs, that would be really quite important. Having more of the vegetables, more of the salads, some of the chicken and the fish and the meat in general, the pulses, the food that makes you feel full and also is full of vitamins and minerals and less of the food that we've mentioned earlier.
Wow, that's amazing. That's actually packed. So, viewers, you've heard it, how you can portion your food to avoid overeating. Talking about that, Prof, I remember when we were in medical school, my professor always said, hypoglycemia kills in 30 minutes, while hyperglycemia would still give you time. Can you tell us a bit about patients with diabetes and the risk of hypoglycemia and what exactly they can do? We're still going to touch on exercise, but I didn't want to forget that. So let's quickly touch on that.
Sure. Hypoglycemia is a problem when there is a mismatch between the amount of medication, or whether it's insulin or other medication in the body, and the amount of glucose in the blood. So if we are not eating enough of the right types of food that last longer, and here is my point, when you eat the apple with the fiber in it, it will last longer. But when you drink the juice, it will go up quickly and will disappear quickly. So if there is mismatch between my treatment, the insulin I'm taking or the tablets I'm taking, and the amount of food, my blood sugar levels will go to below normal level. And that would not good either. And that will make me feel dizzy, about to faint, sweaty, tremor. It's a bad feeling. And that's what we want to avoid. So as much as we want to avoid under treating people, sometimes over treating people with the wrong dose or at the wrong time. And me as a person with diabetes, if I have diabetes, that's why it's important to choose my food. So not going for many hours without any food when the drugs are working. So a healthy snack, an orange or an apple between meals would be helpful to avoid going too high and also certainly avoid the hypoglycemia that people are scared of.
Wow.